Binge eating disorder history. A timeline. What is binge eating disorder? Binge eating disorder, BED, is the most common eating disorder in the United States, and it's diagnosed in all age groups. It's most prevalent, though, among teens and adults. People with BED eat unusually large amounts of food in a short period of time and feel a loss of control and guilt over these binging episodes. Researchers estimate that up to 60% of people who struggle with BED are women. The cause for the disorder is unknown, but there are likely social, biological, and psychological factors. Without help, the long-term consequences of binge eating include weight gain, high blood pressure, heart disease, diabetes, other obesity-related diseases. 1959, first mention of binge eating. BED was first noted back in 1959 by psychiatrist Albert Stunkard. In his paper titled Eating Patterns and Obesity, Stunkard describes an eating pattern marked by consuming large amounts of food at irregular intervals. He observed that some of these episodes were linked to night eating. The term binge eating eventually caught on. It was used to describe eating episodes that were not connected with sleep or the overnight hours. 1987, the APA's DSM, the American Psychiatric Association, APA, mentioned binge eating in its Diagnostic and Statistical Manual of Mental Disorders, DSM, in 1987. At the time, the condition was listed in the criteria and features of bulimia. Bulimia is an eating disorder that takes on a cycle of binging and purging. Inclusion in the DSM is important because it increases disease awareness and gives mental disorders legitimacy. Prior to being included in the DSM, it was difficult for people to receive appropriate treatment for binge eating. Health insurance coverage for treatment of the disorder was also limited. 1994, linked to EDNOS. In 1994, the APA listed binge eating in the DSM-4. At this point, it was still not known as its own disorder, though. Instead, binge eating was included in an appendix as a feature of eating disorder not otherwise specified, or EDNOS. 2008, the beta forms, BED continued to gain more attention. By 2008, a nonprofit called the Binge Eating Disorder Association, BEDA, was started. This group's mission is all about help, support, and advocacy for the BED community. BEDA holds various events throughout the year and an annual conference. BEDA also hosts a Weight Stigma Awareness Week and supports BED research. 2013, full recognition in the DSM. In 2013, the APA released a revised edition of the DSM. This time, the DSM-5 declared BED as its own disorder. This is significant because it finally allowed people to get treatment under their insurance plans. It also added legitimacy to the disorder. The new classification included the following criteria: recurrent episodes of binge eating, association with eating alone, consuming foods rapidly, or feeling guilt and shame, feelings of distress related to eating behaviors, frequency of binging at least once a week for 3 or more months, absence of restricting or purging behaviors, common with anorexia or bulimia. January 2015, drug therapy introduced. In January 2015, the Food and Drug Administration approved the use of lisdexamfetamine dimesylate, Vyvanse, for the treatment of BED. The efficacy and safety of this drug were examined in a study published in the Journal of the American Medical Association. Researchers found that those given 50 to 70 milligrams of lisdexamfetamine dimesylate reported less or even total cessation of binging. They also reported only a few side effects. Where we are today, with BED now recognized as an eating disorder, more research is being done on both therapy and drug-based treatment options. One of the most effective therapies for eating disorders is cognitive behavior therapy. This method continues to be the most popular approach for both in- and outpatient treatment.